Well, good evening and hello, everyone. Welcome to We the People of Detroit's Water Policy Education and Engagement Project, better known as Water Peeps. And this evening, we're going to be discussing mapping the water crisis public health impacts. And I'm so grateful to have three amazing scholars with us this evening, Dr. Josiah Rector, Dr. Nadia Gaber, and Dr. Peter Hammer. And so we're not going to take a whole lot of time because I want to make sure that our speakers are able to give enough time to their presentations and that we also have enough time to entertain your questions. Before we get started, the board of We the People of Detroit, I would like to thank our co-sponsors, Freshwater Future, Redeem Detroit, and Westside. These partners have been an amazing part of establishing not only the questions, give a lot of guidance in terms of what they're really looking for out of these opportunities. And so part of We the People's mission is to inform, train, and mobilize. And so we believe that this evening, as part of this teach-in, you're not only going to be informed, you're not only going to be trained, but hopefully by the end of this evening, you will also be deputized and mobilized. And so the first speaker we have is Dr. Josiah Rector. Josiah Rector is an assistant professor of history at the University of Houston. His first book is entitled From the Motor City to Mass Water Shutoffs, Racial Capitalism, and the Struggle for Environmental Justice in Detroit. It is forthcoming from the University of North Carolina Press. But I would also say to you that Josiah Rector has had some experience here in the city of Detroit. So we do consider him one of our community sons. And the next voice that you will hear is that of Dr. Josiah Rector. Take it away, Doc.
Thanks very much, Monica. Tiana, do you have the slides open? Okay, is there a way that I could get that full screened? I could just look at my own slides, I guess. Okay, thanks very much, Monica, for that introduction. So my paper is called Failing to Learn from the Past, Comparing Race, Welfare Policy, and Water Shutoffs in Detroit During the Great Depression and the Great Recession. So I'm very honored to join this panel, and I want to introduce a historical perspective to this discussion of public health and the water crisis in Detroit. When people talk about water shutoffs, they sometimes compare the situation in Detroit to other cities like Baltimore and Philadelphia that face water affordability challenges, or sometimes to countries in both the global north and the global south. But often these discussions lack a historical perspective. And if we could go to slide 2, I want to make a couple general points here. The water shutoff crisis that we've seen in Detroit over the past 2 decades, but especially in the last decade, is not new in the city's history. Detroit experienced a crisis of water affordability and shutoffs actually during the Great Depression, which began like 2008 with the stock market crash in 1929. In the case of the Great Depression, that ended with the conversion to defense production during World War II, which brought the city close to full employment between 1941 and 1945. Now, if we compare the water affordability crises that occurred in Detroit during the Great Depression and the Great Recession, we see some major contrasts. So in both cases, an economic crash resulted in mass unemployment and impoverishment, which made hundreds of thousands of Detroiters unable to pay their water bills. And in both cases, we see that African Americans are disproportionately vulnerable to water shutoffs. But there are also some major differences. So during the Great Depression, Detroit was able to avoid a policy of mass water shutoffs. Only about 1% of unpaid accounts were shut off during the Great Depression, whereas during the Great Recession, Detroit adopted a brutal and inhumane policy of mass water shutoffs that forced something close to over 250,000 people to live without running water in their homes for extended periods of time, days, weeks, months, in some cases years. So how can we explain this much harsher and more inhumane policy during the Great Recession than during the Great Depression? So I want to advance 2 major explanations for this difference. The first is structural racism, and the second is neoliberal economic policies. So in the 1930s, as in the 2000s and 2010s, African Americans are disproportionately affected by water unaffordability in the city of Detroit, and relatedly unemployment, evictions, and poverty. But in the 1930s, Detroit is a city that's over 90% white, and it has a relatively small but rapidly growing African American population in the aftermath of the first Great Migration from the South. And during the Great Depression, the New Deal restructures Detroit's relationship with Wall Street. In particular, New Deal banking policies enable the city to avoid bankruptcy. They also restructure the city's housing market. About 40% of homeowners in Detroit get their mortgages refinanced by the Homeowners Loan Corporation in the 30s and early 40s. So the New Deal does end mass unemployment, and it ends mass home foreclosures in Detroit, and it creates nearly 100,000 public works jobs. And this makes it possible for the city to avoid bankruptcy and to treat delinquent water accounts, as they were called then, more leniently. On the other hand, the New Deal is structurally racist, as we'll get into a little bit later. New Deal housing policies in particular are racially discriminatory towards African Americans and other people of color. This reinforces segregation within the city and between the city and its suburbs. There are also other limitations to New Deal policies we don't have time to get into. In the Great Recession, though, we see much more regressive policies. We don't see significant federal aid to Detroit. Despite the bailout of the auto industry, Detroit is not safe from bankruptcy during the Great Recession. There aren't significant jobs programs. And moreover, rather than allowing homeowners to refinance with the banks in any significant way, government policy encourages mass home foreclosures. And moreover, the welfare state that was created, especially through AFDC during the Great Depression and the New Deal, is eviscerated in the 90s and 2000s, especially under Governor John Engler and his successors, and all this contributes to the mass water shutoffs. Okay, could you go to slide 3, please? Okay, so let's discuss the economic situation in Detroit during the 1930s for a second. So Detroit had just experienced 3 decades of a sustained economic boom associated with the takeoff of the auto industry, the assembly line, Fordism, and the rest of it. So Detroit's population grows by 5 times between 1900 and 1930. The city annexes 100 miles of territory, and it goes into a lot of debt building out infrastructure, especially water and sewer lines, in the 1920s. And this is based on rising tax revenues, increasing manufacturing investment, rapidly growing population. But then the auto industry falls off a cliff. Following the stock market crash in 1929, car and truck sales fall 75% by 1932. And by 1933, 45% of auto workers in Detroit are out of work. So this is an era before federal unemployment insurance or any real federal welfare state. Rather, welfare is handled through city relief agencies and private charities, and they're completely overtaxed by the scale of the problem. So, for example, in 1928, there are only 3,977 people receiving relief from the Department of Public Welfare in the city of Detroit. That increases 50 times over by 1932, reaching 229,000 people. And if we look at those who are on relief, they're disproportionately foreign-born immigrants and African Americans. So 17% of African Americans and 10.2% of foreign-born immigrants were on relief in Detroit in 1932, compared with only 3.8% of native-born whites. So this is a city that's about 92% white in 1930, and so the majority of those who were unemployed and on relief are white, but you see disproportionate poverty and unemployment among African Americans and foreign-born immigrants. So the bottom line is that the city saw its tax revenues fall almost in half in just 3 years, and the city could not foot the bill for this huge increase in its welfare caseloads. And as a result of that, the city is unable to provide welfare payments. That in turn means that landlords shut off people's water because they're not able to pay. This is a city that was more a city of renters than homeowners in the 1930s, although there are major differences in homeownership rates along lines of race then as now. Could you go to slide 4, please? So Detroit's water rates in 1930 were only about half the national average. So the fact that anyone was unable to afford water in Detroit during the Great Depression is really a testament to the sheer level of poverty that existed. The number of unpaid water bills, or so-called delinquent accounts, skyrocketed in Detroit in the early 30s, as you can see from this graph on the left, which shows the number of so-called delinquencies. So by 1934, in March of that year, over 100,000 accounts were delinquent and in danger of shut-off in the city. Nothing like this had ever been seen before. There were 20,000 new delinquencies per month, and they were increasing in all parts of the city. This graph shows the rates on both the western side, as they called it, the western zone and the eastern zone. That's basically the west side and the east side of Detroit, right? So across the whole city, more and more unemployed people are falling behind on their water bills and are in danger of shutoffs. The head of the Water Consumer Accounts Department, what was then called the Detroit Department of Water Supply, a guy named Hal F. Smith, wrote that there was an alarming rate of delinquencies in the city. And as late as 1936, the city was threatening 30,000 people with water shutoffs during the wintertime. Please go to the next slide. So how did Detroit escape from this crisis? The New Deal played a direct role in preventing mass water shutoffs and relatedly mass home foreclosures in the city in the 1930s. In February 1933, the city had run out of money. The administration of Mayor Frank Murphy defaulted on Detroit's debts to Wall Street banks, and Michigan actually became the first U.S. state to close its banks. But the U.S. financial system was collapsing in 1933. 11,000 banks basically collapsed right before the inauguration of Franklin Delano Roosevelt in March 1933. So in the first 100 days of the New Deal, one of the key pieces of legislation that's passed is the Emergency Banking Act, which stabilizes the financial system with emergency loans to private banks from the Reconstruction Finance Corporation and the like. We don't have time to go into the details, but what's most important for Detroit is that the Emergency Banking Act makes it possible for Detroit to refinance its debt to Wall Street banks. And Detroit is able to restructure its debt so that bond debt that was due within 10 years is now due within 30 years. So Detroit basically is able to restructure its debt to the banks. And the debt is not due until the 1960s. That's crucial. Another key thing that happens is the Public Works Administration and later the Work Progress Administration create together nearly 100,000 jobs in the city, and they rebuild the city's infrastructure. Now, among other things, this relieves the load on the Department of Public Welfare. It's estimated, for example, that of $7.1 million that are spent on public relief in Detroit in 1933, only 4% of that is coming from the city. The other 96% is coming from the federal government in the state of Michigan. So the feds basically step in and they bail out the city. They provide massive numbers of jobs in public works. And the Homeowners Loan Corporation restructures about 40% of the home mortgages of homeowners in the city. Now, the Federal Housing Administration and the Homeowners Loan Corporation are notoriously racist against African Americans. The Homeowners Loan Corporation draws up the maps that redline communities of color, and the FHA is discriminatory in granting loans. It should be said that actually thousands of African Americans do get home mortgages through the HOLC and the FHA. Actually, African Americans get more FHA mortgages in Detroit than in most cities, almost at parity with whites in terms of as a rate or as a percentage of the number of Black homeowners. The key point, though, is that the FHA and the HOLC will only insure mortgages for African Americans in segregated inner city neighborhoods, and they refuse to insure mortgages for African Americans in the suburbs or in white segregated neighborhoods. And the consequence ultimately of FHA and HOLC policies is to create a residential apartheid, which reinforced what already existed due to restrictive covenants and racist mob violence by whites going back to the 1920s. And so Detroit becomes increasingly racially segregated, and it's surrounded by these virtually all-white suburbs. As late as 1968, there are 16 suburbs surrounding Detroit that have no Black homeowners. And so the New Deal is paradoxical. On the one hand, it provides real benefit to the poor, to the unemployed, and to African Americans insofar as it does provide jobs and it does help many people avoid foreclosure. And it ends the water shutoff crisis. It makes it possible for the city to settle over 100,000 unpaid water bills. That could never have happened without the New Deal. On the other hand, the New Deal reinforces racism at a structural level within the housing market. Next slide, please. Okay, so we don't have time to go into any detail about the period between the Great Depression and the Great Recession. I don't want to go over my time, but there are two major structural transformations that occur basically between 1950 and 1980 in the city of Detroit. On the one hand, the federal government policies, including increased federal aid to cities and public investments in infrastructure, which are then enlarged during World War II with the conversion to defense production and investment in highways, is enlarged massively. Federal government investment in the interstate highway system and ensuring mortgages for tens of millions of families, and in building out also sewer, water lines, and other kinds of infrastructure, all massively subsidize the creation of middle-class white suburbia. And they do so on a racially exclusionary basis. In 1947, over 90% of the housing units in Detroit are closed to African Americans. And federal housing policies reinforce that. And it's really not until the Fair Housing Act of 1968 that there's any kind of legal sanction against these forms of discrimination. And as we know, redlining and housing discrimination continue up to the present, albeit in less overtly codified forms. At the same time, the basis for Detroit's unionized blue-collar working class and their ability to buy homes is undermined by deindustrialization. Detroit loses 335,000 manufacturing jobs between 1950 and 1983. So on the one hand, you have the flight of the city's manufacturing base. On the other hand, you have the flight of whites to the suburbs with the aid of these racist housing policies underwritten by the FHA and then the VA after World War II. And this coincides with the second great migration of African Americans to Detroit. So if you look at the graph here, you can see how around between 1975 and 1980, the city becomes majority African American. And it does so in the context of this process of suburbanization fueled by racist housing policies and the withdrawal of industrial capital from the city as corporations like General Motors and others are decentralizing their operations into suburbs, into rural areas, and then ultimately overseas. Next slide, please. So the story that I just told there will be familiar to anyone who's read a book like Thomas Segru's The Origins of the Urban Crisis. That's relatively familiar. The story that's not told often enough is what happened after that. So by 1980, you already have segregation and concentrated poverty in Detroit as a result of housing discrimination and deindustrialization. What happens in the next 40 years between 1980 and 2020 is that these problems are deepened and exacerbated by neoliberal economic policies, which reinforce structural racism and poverty. So in particular, there's a set of policies that lead directly to the crisis of mass water shutoffs and mass home foreclosures, I would argue, in Detroit in the first 2 decades of the 21st century. And those are especially welfare reform, which destroys AFDC and removes the very meager safeguards against absolute destitution facing the poorest third of households in the city. Financial deregulation, which enables the same banks that had redlined the city to then market predatory subprime loans to households and predatory interest rate swaps to the city government, contributing directly to home foreclosures and debt. Tax cuts, which allow corporations to pay less and less of their fair share in terms of supporting public infrastructure and allow wealthy individuals to contribute less and less of their fair share and further starve the city of resources. And austerity policies, which are then implemented in a dictatorial fashion under emergency financial management. And you can see the outcome of these policies just if you look at rates of poverty. The percentage of children and youth living in poverty in Detroit increased from 34.8% in 1999 to 59.4% in 2012. So this is a process of impoverishment that is driven by the combination, I would argue, of structural racism and neoliberal economic policies. So key here are the end of AFDC in 1996. Now, in addition to scrapping AFDC, which was a core New Deal program, welfare reform devolves spending on welfare from the federal government to the states in the form of block grants. And then you have governors like John Engler in Michigan who gut not just welfare but utility bill assistance starting in 2002, which contributes directly to the rise in water shutoffs. The repeal of Glass-Steagall in 1999 enables the mergers between investment and commercial banks, and these so-called too big to fail banks then prove enormously damaging to Detroit, because it's the sheer size of those institutions that contributes to the devastating nature of the crash of 2008. These institutions, which had been marketing subprime loans to the city, also are responsible for a collapse in property values in the city of Detroit. And also the marketing of toxic financial instruments from subprime mortgages to interest rate swaps. And then Public Act 4 and Public Act 436, which empower emergency financial managers to take over the city, to privatize public functions, and to do things like regionalize the Detroit Water Department, which we don't have time to get into. Next slide, please. Okay, so I just want to briefly summarize how I see these factors coming together to produce the catastrophe of mass home foreclosures and mass water shutoffs in 21st century Detroit. So it's estimated that over a third of the properties in the city of Detroit go into foreclosure between 2005 and 2015. Now, we often associate the subprime meltdown with 2008, but it started in Detroit before that. In fact, in the number of home foreclosures in Detroit more than tripled between 1996 and 2003. You already see banks aggressively marketing subprime loans in the city in the early 2000s. And it's really in the early 2000s, and that's post so-called dot-com recession, that the water shutoff crisis really starts. And it non-coincidentally comes immediately after John Engler's scrapping of the vendor pay program and the removal of utility bill assistance for the poor in Detroit. And then, of course, in 2005, the city council passes a water affordability plan that had been pushed by Michigan Welfare Rights and other organizations, but never implements it. So in addition to the gutting of the welfare state in the city of Detroit, you also have the removal of utility bill assistance. So by 2002, there were some 30,000 people at risk of water shutoffs, and that steadily escalated. In 2005 to 2007, Detroit had the highest rate of subprime mortgage foreclosures in the United States. The subprime mortgage foreclosures are already cutting into the city's tax base. They're driving population loss. And then in 2007, 2008, the global financial crisis driven by the deregulated banking sector devastates Detroit's tax base even further, sharply reducing property values. Meanwhile, the city of Detroit and Wayne County are continuing to levy taxes unconstitutionally at the prior assessed values, despite the collapse in property values in the city as a whole. And as Bernadette Atwain and others have shown, that contributes to over 100,000 tax foreclosures in the city of Detroit over the past 10 years. Also, DWSD's debt increases as a result of the sale of predatory interest rate swaps. So notoriously, Detroit made a series of interest rate swap deals with creditors. And in 2005, the city entered a $1.44 billion deal with UBS AG and Merrill Lynch Capital Services, which was later acquired by Bank of America. And the interest rate swap is essentially a gamble that interest rates will rise rather than fall. Interest rates fall as a result of the 2008 financial crisis. Detroit loses the bet, and its pension debt increases by $770 million. And DWSD is charged $547 million in swap termination fees by the banks, which pushes up debt service at DWSD to 40% of revenues by 2012. All of this is used as a pretext for the imposition of emergency financial management. Indeed, of the $18 billion that are cited as a rationale for the imposition of emergency financial management in terms of the city's overall debt load in 2013, the largest share of it, over $5 billion, is for DWSD, even though that's a regional liability, not just a Detroit liability. And so I won't rehearse what Kevin Orr then proceeds to do, but the most important thing from our perspective is the water shutoff policy that's instituted is much harsher. specifically following the takeover by emergency manager, or the city institutes a new policy where anybody beginning in March 2014 who is $150 behind on their bills or 60 days overdue will be shut off. This is the harshest water shutoff policy in Detroit history. There's no coincidence that it's levied under emergency financial management, which enables basically the bondholders to get their way even at the cost of creating a humanitarian crisis. Okay, final slide, please. Okay, so in conclusion, I just want to stress a couple major points. So what can we learn from the Great Depression and the New Deal? The number one thing is there is a successful historical precedent for avoiding mass water shutoffs in Detroit during a water affordability crisis. The crisis of the Great Depression was just as deep as the one of the Great Recession. And how was it done? Well, it was done with an enormous amount of federal assistance. Federal aid pushed by Mayor Murphy made it possible for the city to avoid bankruptcy. The investment in public works jobs and public relief made it possible for the city to negotiate with those who were behind on their water bills. Credit installment plans were instituted. There were longer waiting periods, but through a variety of mechanisms, the city was able to renegotiate and refinance with those facing home foreclosures, as well as those facing water shutoffs. Now, the New Deal was structurally flawed because of its entanglement with structural racism, especially in the form of housing discrimination. And so obviously we don't want to repeat that. I would argue that the progressive elements of the New Deal are a useful template for some of what needs to happen, but this time we need to center racial justice, right? So going beyond the New Deal, I would say means prioritizing frontline communities, disproportionately low-income communities of color in the large-scale public investments, jobs programs, and social welfare policies that we need to abolish poverty and end environmental racism and environmental injustice. So we need to connect targeted investments in frontline communities with policies like a moratorium on utility shutoffs and foreclosures, and a water affordability plan like that has been advocated for over a decade and a half by Michigan Welfare Rights to finally achieve a just water rate structure, but also, even more fundamentally, I would argue, to abolish poverty. To go back to the Poor People's Campaign that Martin Luther King died participating in, or the Freedom Budget, and the long legacy of connecting racial and economic justice struggles, I would argue we need to have a guaranteed income for those who are outside of the paid workforce, as well as a job guarantee so that anybody who wants a living wage job can get one from the federal or state and local government. We also need a homes guarantee. Housing is a human right, just as water is a human right. Healthcare for all. The scandal of the United States having the rate of uninsured people that it does, despite the amount of affluence that is generated by corporate interests in our economy, is also intolerable. So in all these ways, I think we need to push beyond the most progressive elements of the New Deal, but center racial justice. So that's all I have to say. Thank you very much.
And thank you so much, Dr. Richter. As was already anticipated, we knew you were doing a wonderful job of giving us historical context for what has been happening with water, but also to connect it to where we are today. And I want to just remind everyone to please place your questions in the chat. We're going to move right into our next speaker because we want to make sure you have enough time to get your questions answered. Dr. Nadia Gaber received her PhD in medical anthropology from UCSF and UC Berkeley, and is obtaining her medical degree with support from the National Institutes of Health. Her research considers how the social and material legacies of racial capitalism flow through water politics. She is a proud member of We the People of Detroit's Community Research Collective, and the next voice you will hear is that of Dr. Nadia Gaber. Take it away, Doc.
Thank you. Thank you all so much. Thank you, Monica. Thank you, Josiah, for that really interesting presentation. I learned a lot. Obviously, this is an unprecedented moment for all of us in our history, and a very difficult time for many of our families. So I just want to say that we're humbled and we're honored that so many of you could join us. And what I'm going to try to do is, on behalf of the Community Research Collective, including Emily Cudel, who led much of this work, who's well but not here, I'm going to build on some of that history and bring it into the present through what We the People has done in terms of researching the health impacts of water, and try to talk about not just what we know, but how we know it, because really the politics around getting this data have been part of the learning process and part of the struggle itself. So this is community-led research, but it's also community-owned research. I say that to just let everyone know this is really for you. This is data that many of you helped collect. So please, if I make a mistake, interrupt me. Please put questions in the chat, or even feel free to just unmute yourself and interrupt. So Community Research Collective of We the People of Detroit is, I want to say, about 5 years old, but I may be losing track of time. And it's a collaboration between activists, academics, researchers, and designers to try to answer the questions that are most important to the citizens and residents of Detroit, and to make sure that those are well studied and well represented at tables of law and policy in terms of the decision making that impacts people's everyday lives. So we have projects on land, water, and education. And just a quick shout out and look out for the education book, which is going to be coming out soon. But since today's topic is on water, I'm going to give you a little bit of background from our work in that sector. So next slide, please, Tiana. So as many of you I'm sure know, drinking water is a kind of national crisis in waiting. A study that was done in 2017 said that more than 35% of Americans, more than a third, are at risk of losing access to basic water and sanitation services because the rates are unaffordable. And that projection was set to be in 2022. So now we're even closer to that date, just 2 years away. So that's a threefold rise in just a 5-year period. So it's pretty dramatic that bills are going up for many of the historical reasons we just talked about. Next slide. Thanks. So of course, during COVID, this became all the more pressing an issue. So many states, including Michigan, pushed for executive orders to curtail the ability of utilities to shut off people's water. So we had at least 34 states that put in place some kind of shut-off moratorium, whether it was a full moratorium in effect and a restoration of services, which we saw in Michigan, and all the states who are similarly shaded in that dark blue. Some put in a moratorium but left people who didn't have water without water. And some states put in these partial moratoriums, or many had no moratorium at all in effect, which meant that even during a pandemic, as important as it is to wash your hands regularly and to clean your doorknobs and make sure you have a sanitary living environment while you're sheltering in place, states could still shut you off if you couldn't afford water. So next slide. Sorry about my dog. So this is a map that shows what shutoffs look like by zip code in Detroit. So we did it a mapping based on the left, you have the highest number of cases. So the top 10 zip codes with the highest number of cases are outlined in black. And on the right, we did them by the highest rate of cases. So taking into account how densely populated that zip code was. And they overlap fairly well. Next slide. Going back, when we look at Detroit as just one piece of the DWSD system, which is now partially leased to form the Great Lakes Water Authority, we see that the city of Detroit owns and operates this regional water system that, as Josiah said, has been built out to such an area that it actually supplies about 40% of Michigan residents with water, just from the city that Detroit took out all these bonds, paid for, and maintains. And that included the city of Flint just before they made the notorious decision to try to build a private pipeline and switch off of Detroit water. So with the expansion of that system, that debt has been shouldered disproportionately by residents in the city of Detroit. Next. This is a map we did kind of showing the decades of that progression, that building outwards. And you can see just that second block is 1940 to 1949. So putting into context what we just heard, we were already building out this infrastructure into the suburbs, and it literally subsidized the creation of the suburbs because you're supplying them with this vital infrastructure that every city needs to be able to run. Next. Then came, of course, this escalation of water shutoffs, and you saw this map that we, the people, did in Josiah's presentation. But one interesting feature about this map worth just reiterating is that it's really under the period of emergency management when citizens' democratic rights and their voice in their own government was suspended by the governor that you see these shutoffs escalate. So without that kind of transparency and accountability, the city emergency managers were able to have unprecedented levels of water shutoffs. And the only times that we really see them drop were actually when residents pulled in media attention, including Michigan Welfare Rights and People's Water Board and others inviting the United Nations to come and actually review the situation in Detroit and deem that what was happening was a violation of the international human right to water and sanitation. Next slide. This shows, again, from mapping the water crisis, what the racial distribution of emergency management looks like. So all of, on the left, everywhere that's outlined in a dark black line is a city or a district or an entity like the school districts that was taken over by emergency management. And the dotted lines show the demographics of that region. And the purple dots represent African American, the white dots represent white Americans, the orange dots are Latinx, and you can see how heavily concentrated. First of all, you can just see how segregated the geography of this region is, which I'm sure we're all familiar with. But you can also see how it's as if they just took a line and drew it all around the places that are majority Black, took them over, and took full control. And we saw that also with the creation of GLEWA, or the Great Lakes Water Authority, from the Detroit Water and Sewage Department, where the representation of Detroiters, you can see on the right, used to be 4 out of 7 of the Board of Water Commissioners members, but on the GLEWA board, it's only 2 out of 6. So again, this just represents a kind of regionalization and a lessening of the power and the voice of Detroiters to own and have a say in their water system. Next slide. So let's go back to what this looks like in the city of Detroit. We have, again, these are the same lines we saw earlier in blue, where the black line outlines the shutoff rates, the zip codes at the highest rates of shutoffs in Detroit. And the red shading here shows the number of households with children. So you can also see on the left that where shutoffs are highest, you have the most concentration of households with children. And on the right, you can see that those same zip codes of same areas that are subject to water shutoffs also have the highest number of residents over age 65. This, of course, becomes extremely important during the pandemic, when we know that children are often asymptomatic spreaders of the coronavirus, and often to people who live in their same households. And that people who are over age 65 are more vulnerable to the serious complications of coronavirus and have higher rates of serious illness and death from this pandemic. Next slide. Thanks. So we look at that together. This was done in late June of this year. So looking at the COVID cases that had come through Detroit and where they were concentrated. And the yellow numbers are supposed to, sorry, the zip codes aren't that visible, but the zip code numbers are on the right. The last 3 digits will tell you the zip code, 48, and then those 3 digits. And And so I think the graph on the right, let's focus there, shows the total COVID cases per zip code. And then the little pie graph, the yellow part is the part that's attributable to nursing homes. So we know that nursing homes were areas where a lot of people live in together, they can't socially distance. And once the virus came into nursing homes, it was often very hard to stop it. But at the same time, when you look at what's happening, you can see that we have zip codes and areas, particularly on the west side, where you had a very high number of coronavirus cases, but the pie graph of where the nursing homes were, the percent that were in nursing homes is actually quite small. So I think a lot of the media, and we were noticing at the time that a lot of the media was just writing this off as nursing home spread, when actually most of the spread was in the community, in these very same neighborhoods that were affected by water shutoffs. Next slide. So putting that all together, you can just see that really clearly with those lines placed back on of where the highest number of shutoffs happen are also the areas where the highest rates of COVID happened, and the areas where most of that spread was in the community rather than in nursing homes. Next, thanks. So taking it back, in many ways, this reinforced what we already had learned through citizen-led research and honestly, what we were most afraid of. So in 2016, 2017, we, the people of Detroit, partnered with the Henry Ford Global Health Initiative to do a study using their emergency department records of how water-related illness traveled in the city of Detroit. Next slide. And they found that patients who were admitted to Henry Ford hospital systems were 1.5 times more likely to live on a block that had experienced water shutoffs and then contract a water-related disease. So mostly these are stomach diseases, skin and soft tissue infections. And they also found that that was true in reverse. So if you lived in an area with high water shutoffs, you were 1.5 times as likely to be diagnosed with one of these water-related illnesses. And that's even after we controlled for sociodemographic factors, for poverty. And the interesting thing, I think, was that this not only said that if you have your home shut off, you are more likely to experience water-related illness, but that if you live in an area or a neighborhood where shutoffs are happening, you're also more likely to experience water-related illness, because we know that infectious diseases travel. They're contagious and they travel. So that was an important finding. And that was a finding that was really not allowed to be published in the peer review literature because of some of the politics around wanting to keep quiet what the public health impacts of water shutoffs were in the city. Next slide. Then we had George Gaines, who was the former deputy director of the Detroit Health Department, who did a review of the communicable disease reporting at the state level and found that at the time when water shutoffs were most intensified, you had these significant rises of waterborne diseases like Campylobacter, shigellosis, Giardia. These are diseases of contaminated water that are not often seen in the urban United States. But we saw a huge spike in them, threefold in some cases, as water shutoffs were on the rise. And his conclusion was that water shutoffs were the plausible mechanism and the plausible cause of this increase and needed to be stopped. Next slide. Well, then we heard you can't draw any conclusions from this. It's just correlation. We don't know what's happening on the citywide level. Like maybe you're just cherry picking the neighborhoods that are hardest hit. So we used a toolkit from the CDC that's used in emergency response to survey large areas like whole cities, called the CASPER toolkit. Next slide. And we went all over the city of Detroit. We had, again, many of you, over 40 volunteers who worked over many days to randomly survey residences across the city of Detroit and ask them about their water status, the affordability of their water, if they had experienced any symptoms because of it. And the yellow dots show everywhere across the city that we went. Next slide. Here's a picture of that process of some of the volunteers who were with us doing the random sampling, doing everything up to the scientific reliability standards of the toolkit so that it would be immune from allegations that this wasn't a scientific study. Next slide. And with our survey on the left, here's some of what we found. So just at the time of contact, 5% of the households that we encountered were without water. We referred all of them to We the People of Detroit's Water Rights Hotline, and were able to provide emergency water to them. So that was a very important thing, that we weren't just going in to do research without being able to offer services for people who didn't have water and were in crisis. And we found that 17% of the households were or had been shut off from water, and 26% were currently at risk of being shut off. That's an astounding number, especially in context of what I just learned from Josea's talk, that only 1% of households were shut off during the Great Depression. Here we had more than a quarter of the city at risk of being shut off. And the average length of time that people we sampled stayed without water was 10.5 days. This was as the city put out publicly that nobody was without water for more than 48 hours, and that most were turned back on within 24 hours. And we just knew that that wasn't true from doing this research. The average water bill was $371, and 26% of the residents were always or usually stressed about affording their water bills. Next slide. So also at that time, there was the county health authority kind of stepped in to do what the city Department of Public Health wouldn't, which is to recommend a moratorium on shutoffs, which means that it would be illegal to shut off water to vulnerable groups of people. And those groups of people included infants and children under 18, seniors age 62 and above, people who live with mental illness and disabilities, expectant and breastfeeding mothers, people with chronic diseases, or otherwise in critical medical condition and in need of care. Based on this CASPER survey that we did all the way across the city, 82% of households are vulnerable enough to be, would be ineligible for shutoff under that recommendation. Next slide. So then we followed up with another community-led study, following up on what people told us about how anxious, worried, and stressed they were about affording their water. And with partnership from Brightmoor Connection and Reverend Rosalind Bouye, we conducted a psychological distress study in the Brightmoor neighborhood and asked people specifically about their symptoms of mental distress and also about the affordability status of their water. So next slide. And the part on the right is kind of our table from the paper, which I'll just summarize. We constructed a kind of water insecurity scale that reflected the water needs of the residents in this area, and then also was able to specifically look at this measure of mental health. That's a statistical measure that many studies use. So again, this is a validated public health instrument, and taking that instrument and putting it in the hands of community, we were able to find a statistically significant association. Now to community, I think to many people, that's kind of letting science tell you what you already know, which is if you can't afford your water or if you don't have running water in your home, it really impacts your mental health. But putting the numbers to it was important for us to be able to demonstrate that we had controlled for other variables and we had controlled for other factors, and that this specifically related to how unaffordable water was. And it was true even if you couldn't afford your water, not only if your water was shut off, although if you didn't have running water, the effect was greater. Then this table two, actually let's go to the next slide because I have it blown up. Emily, who's our wonderful designer, just makes things look so much clearer. When we asked people about if they had changed their health-related practices and related to water, we found that more than 80% of the people who answered had drank water they thought might be unsafe for their health since the city began these mass water shutoffs. And more than a third were collecting water from an undesirable or dirty source. Again, more than 80%, 8 out of 10 people were worried they wouldn't have enough water to meet their basic needs. So this was a pretty dramatic portrait, even for those of us and even for people who are delivering water and running the water rights hotline. At the same time, you saw the same rates, 80% of people who were borrowing and sharing water, which I think speaks to how much residents were coming together to support each other, despite being cut off from this vital city infrastructure. Next slide. So that paper, after a long process, was actually just published. It was published in the Journal of Public Health, and it was actually picked up by The Guardian in their series that they have on America's water crisis, and I really recommend it. It's a really good set of investigations that builds on a lot of the work at Bridge Magazine and that Kurt Guyette and other reporters have been doing, Martina Guzman, on this crisis. But I believe that this study, which again was community-led, is the first quantitative study, or the first to put numbers and show a statistically significant mental health impact of water insecurity in the urban United States. And I think that's both to just speak praise to We the People of Detroit and the research collective that they've organized, and the power and the possibility of community research, but it is also a blight, I think, on our city, state and county public health departments, who historically have taken the responsibility to do this kind of research, but with the water shutoffs, really bowed out of that responsibility. Next slide. So our recommendations are the same as they have been, that there must be an immediate moratorium on all water shutoffs, and it has to be made permanent. So this moratorium that was put in place with Governor Whitmer's executive order was recently nullified, meaning that there is no protection in place. There is a Senate bill regarding water restoration and a moratorium, and those protections need to be made permanent. Nobody should have to live in any country, let alone the wealthiest country in the world, without basic access to water and sanitation, both for their own dignity, their own health, but also for the health of community. As we said, infectious diseases are contagious, and they spread outside of the boundaries of the house of people without running water. Next slide. So I just wanted to end by bringing it back to the present and thank the People's Water Board for bringing attention to this rise in cases that has returned just at the last couple of weeks. Unfortunately, there are more cases, and the daily cases continue to rise in Detroit, although we did, perhaps in part because of the restorations of water service, see cases drop and stay pretty low over the summer. Now that those protections are lifted, all of a sudden we see cases rising again. And Michigan is one of the states with the most racial disparity in cases and outcomes of coronavirus of any state in the country. Next slide. So our last slide just takes us back to Monica's ask and call of all of us, which is that we want you to feel deputized to advocate on behalf of this issue, to get involved with us, to do research, to deliver water, to make a donation if you're able, or just to sign up for our email list or social media at wethepeopleofdetroit.com, where you can stay involved in a number of ways. But most importantly is that you feel that the power that I think these emergency managers and many of these politicians have tried to strip from the residents of Detroit is in fact with us all along. And it's been a privilege to organize with We the People of Detroit, and we hope that that you join us. I'm happy to take any questions when we get to Q&A.
Thank you so much, Dr. Nadia gave her just an amazing addition to the team, and has done an exceptional job on leading public health work with We the People of Detroit Community Research Collective. As was shared, please put your questions in the queue, in the chat. We're going to queue those up with Tiana in a few minutes. But I just wanted to take a moment of privilege to acknowledge a few folks. I see that we have on the line two of our board members, Professor Aurora Harris, yay. And also we have our CFO, Deborah Taylor. Both of these young ladies are also co-founders of We the People of Detroit. So there is no We the People of Detroit without these amazing women and the work that they do to keep us grounded. But I also want to shout out that we have some of our eldership on the line, people that have really led the charge around water affordability and really fighting for Detroiters to have access. And so just wanted to make sure that we acknowledge that we have the amazing attorney and leader of the legislative fight, Alice Jennings, on the line. And we also have one of the legislative architects of water affordability, none other than Queen Mother herself, Reverend Dr. Joanne Watson, along with members of Water Peeps from Westside Unity and also from Redeem Detroit. And we also see our friends from all over the Great Lakes, from Chicago, Toledo, Milwaukee, Wisconsin. We appreciate you being on the line. And so our next speaker that we're going to have is a young man that we have had as a friend for a long time. And we really appreciate him. He is Dr. Peter Hammer. Peter Hammer was and has taught at Wayne Law since 2003, and he is the director of the Damon J. Keefe Center for Civil Rights at Wayne State Law. The Keefe Center is dedicated to promoting the educational, economic, and political empowerment of underrepresented communities in urban areas, and to ensure that the phrase equal justice under law applies to all members of society. Hammer was instrumental in editing and compiling Judge Damon J. Keefe's biography, Crusader for Justice, Federal Judge Damon J. Keefe, in 2013. He has become a lead voice on the social issues impacting the city of Detroit. The next voice you will hear is that of Dr. Peter J. Hammer. Take it away, Doc.
Great. So I'm going to share my own slides, so I'll apologize for the short interruption, and we will start from the beginning as always. And I want to be talking about the relationship between spatial structural racism, many of the issues that Nadia and Josiah have already wonderfully addressed, but frame it in a term of thinking about the relationship between race, rates, and infrastructure. And hopefully giving some people some intuition about thinking of the dynamics of the way in which systems of oppression are produced and reproduced over time, and how some things we take for granted, such as rates and infrastructure, are really critical parts of understanding that story. I always like to give a shout out to Judge Keith. Particularly in troubled times, we've got to think about our ancestors and role models and heroes, and we need those inspirations now, I think, more than any other time. So I want to situate this also in the historical moment that we're in, where we realize that the name of George Floyd has come to symbolize the cumulative effects of over 400 years of racism in America. And that we're facing multiple pandemics. One pandemic of police brutality, another pandemic of racially disparate impacts from COVID. But as our speakers already have suggested, these are interrelated. COVID can be seen as the intersection between spatial racism and the politics of fiscal austerity, or what international folks call neoliberalism. And police brutality can be looked at as the intersection between structural racism and militarization. And we've got to start thinking about the deep interconnectivity of these issues and how none of these things are either accidental or unrelated. Given that bold claim, we also have to acknowledge that society, the media, the politicians teach us nothing about this. And we have to ask my favorite question of my own students: why? Why aren't we being taught by leaders, schools, the media about this interrelationship of issues that are producing these forms of inequity? Right? And often it's hiding in plain sight, which is a motif. You go back to Ralph Ellison and The Invisible Man. But if you think about European Americans are trained and socialized not to see the racism that surrounds them. Right? That becomes a critical part of media and socialization. And there's a wonderful field called the epistemology of ignorance that realizes that not only does knowledge have to be constructed, ignorance has to be constructed. And we have to start getting much more sophisticated in thinking about how ignorance that lets people deny the existence of racism is a critical component in perpetuating those forms of racism. And Charles Mills, who wrote The Racial Contract, is a wonderful source to be looking deeper into that. So that's the story of European Americans, right? But then you have to realize that Americans of color confront racism every day of their lives, right? They can't walk out the door without being beat over the head with racism. And Judge Keith would often say, and it's in the biography, that there wasn't a day of his life that he wasn't reminded in some way, great or small, that he was a black man in America. And this is one of the greatest jurists this country has ever produced, which just underlies the score that we have to start lifting up the expertise of Americans of color. their knowledge and understanding of racism needs to be centered, honored, and respected, and they need to lead the way in getting us out of the morass that we're in. While European Americans really have to start and undergo a lifelong process of unlearning so much of what they've been taught and relearning how to see again. And I want to use tonight as an illustration of how to see and understand these dynamics of spatial structural racism better, and how they're deeply interconnected with the crisis of water quality and water unaffordability in the city of Detroit. If we truly learn how to see, we start to see what I call archaeological evidence of structural racism everywhere around us, right? And once you learn to see it, you just can't stop seeing it. And I want to try to do that tonight through a lens of looking at the relationship between race and rates and infrastructure. And this is a wonderful book by Daniel Nemser that has nothing to do with Detroit, but starts to think deeper about that interrelationship between infrastructures of race, even though the book looks at the colonization of Mexico and the formation of infrastructure and the domination of indigenous peoples in the very beginning of colonization in Latin America. So what do I mean when I think about race, rates, and infrastructure? Right? And it's helpful to start getting some definitions out there. The definition of structural racism that we use at the Keith Center looks at the interinstitutional dynamics that produce and reproduce racially disparate outcomes over time. Right? So if we think about a racially disparate outcome in terms of water shutoffs, how do we think about the interrelationship between the history of education, of housing, of transportation policy, of water policy, of fiscal policy, that Josiah was talking about, of regulations of fiscal and secured assets? What is the interinstitutional relationship and dynamics that produce these racially disparate outcomes, and equally important, that reproduce it over time? And you have to sort of understand that racism doesn't happen in isolation. Racism requires an entire bureaucracy, entire administrations and infrastructures in order to operate. And at that point, you can start thinking about the water infrastructure really as a metaphor to help explain the dynamic reproduction of these forms of inequalities over time. And we think about the race structure, and we think about the way that race structure has been operationalized over time really is one of those bureaucratic mechanisms of oppression that are actually manifested through the administration of what is a public asset, right? And that's a sort of part of the irony here. I want to think about regional growth. And this is kind of a nice way that I can connect the Great Depression in the 1930s with some of the maps I'm going to steal from We the People that you saw from Nadia to the present day. But the region of 80 years ago didn't exist, right? The sort of going out what we would now call the suburbs were hinterlands, were agricultural. We have to remind ourselves that the growth of this region happened over time, right? And it was intimately connected with needing access to water. And this is where I'm going to quickly go through those slides we saw before, but I want you to think about this relationship that I wouldn't have the growth of the suburbs unless I could give people water, right? And so we often talk about transportation and roads as being what created the suburbs. What we don't realize is that water was critical and essential, and water has a particularly unique story in the city of Detroit. Right, so sort of think about, 1950s, the growth of that water system, the 1960s expanding even further, the 1970s, right, 1980s and 90s, creating this amazing water system, which was owned by the people of Detroit as an asset that really helped create what we now call the suburbs, right? And I'm now going to overlay the sort of growth of the suburbs from the 1950s forward, also demonstrating the racial demographics. So you're going to see green dots that represent census tracts of predominant African-American communities, and then white space, right? And the white space is represented by the yellow in these maps. And I want you to focus on two things: the kind of shifting location of the African-American population, but also look at the roads, right? Because the roads will be an indication of the growth of the suburbs. So the more intense roads that you're going to be seeing over these periods is also an illustration of the intensity of suburban development. And we're going to make that same trip from 1950, right, to 1960. And we're seeing again the sort of white flight. We're seeing the shifting boundaries of the African-American communities in the city of Detroit. The 1970s, and the roads are getting more intense, as well as the shifting populations. 1980s, 1990, right? And overlay again those maps on water, that I could not have had this growth of this white suburban space unless I could turn the faucet and have water coming on. And so a critical part of the growth of the suburbs was also a growth of the Detroit water and sewer system. Right. So now I want to introduce the notion of spatial racism, right? And it's going to be linked to opportunity mapping, and it is a direct consequence and outcome of those two shifting series of maps that I've shown before. And to get time for questions, I'm going to sort of go through this quicker, right? And say, what I want to do is define opportunity and realize that anything that can be measured can be mapped, right? And an opportunity is exactly what you think. What's the quality of housing, employment, schooling, health, transportation, food systems, living environment, right? And imagine that you want to look down at Southeast Michigan and all you could see is the presence or absence of opportunity. And we want to paint in your mind's eye a map where we're associating areas of high opportunity with dark, rich colors. And we're going to associate areas of low opportunity and light, pale colors, right? And this was done by the Kirwan Institute and commissioned by the Michigan Roundtable. And this is the map that they produced. And it shows an incredible segregation of wealth and opportunity. And to situate people, we have what you could see from outer space is an opportunity desert, right? But that opportunity desert has a geopolitical name, and we call that Pontiac, right? And that lets you kind of situate all the rest of the maps. So we have here an opportunity desert surrounded by a sea of opportunity, right? And we know historically Oakland County is one of the richest counties in the country, right? And so we have to ask my favorite question, why? Why do I have an opportunity desert surrounded by a sea of opportunity? I can come down here and almost see the outlines of 8 Mile, right, as a demarcation of where opportunity is and isn't. And I can see the gross points here as areas of high opportunity. And then I see Detroit as an area of lower opportunity visible from outer space. And I always pause at this point to remind people, this is a story of systems and not individuals, right? It's a story of systems and not individuals. To create opportunity requires infrastructure, going back to race, rates, and infrastructure, requires elaborate political infrastructures, economic infrastructures, and social infrastructures. So what this map really shows is the investment in opportunity infrastructures in some place and the disinvestment of opportunity infrastructures in others, right? So again, we're talking about systems and not individuals. The next map is going to overlay racial demographics, and it'll be a story in black and white, and you're going to see green dots again, and the green dots are going to represent majority African-American populations by census tract. And this is what the Kirwan Institute produced, right? And I'm just going to toggle back a little bit. And I know many people that see me talk have seen this before, because I believe this is the most important map that influences every single social policy issue that anybody could care about, right? And I'll keep showing this map until you're going to see it in the evening news, right, on the Detroit Free Press. But that goes back to reinforce that notion of white ignorance, right? We have to construct ignorance and not produce maps like this, not to make these things socially conscious, because the inequality can't perpetuate itself if we actually see the root causes and manifestations, and we start to see that archaeological evidence of spatial structural racism, right? But this is the result of the water system, right? This is the result of suburbanization of white space. This is not an accident, right? So the construction of spatial racism is a direct result of that 50 years, 80 years of policy, right? And this is what produces water shutoffs. And we're going to sort of pick up that story and try to think about that in this relationship. But what are some of the immediate lessons? First lesson, the Detroit Water and Sewer Department enabled the creation of the wealth that now defines the region, right? That wealth in Oakland County, one of the richest counties in the country, was created by the water system, right? Or greatly contributed by the water system. Detroit Water and Sewer could not charge and make a profit, right? By state law, they could only charge the actual cost of the service. So while they're enabling the creation of all of this wealth, they can't accrue any portion of that wealth. And under a state mandate, Detroit Water and Sewer System subsidized the white flight and the white suburbs that created the spatial racism, right? You would not have all of these dynamics without the water and sewer system. And yet the spatial structural racism that we've seen maps on also to municipal distress, right? Go back on the data about deindustrialization of jobs, right? And the flight of wealth to the suburbs. What does that do for Detroit property markets? And we had the discussion about the collapse of the housing market. We have structural causes of the municipal distress that allegedly triggered the financial emergency, that allegedly necessitated the emergency manager, right? And we say the root cause of that right? Not the consequence. The cause of that financial distress was spatial structural racism. Right? And if we don't get the causation right, we don't understand the even greater injustice is created when you declare financial emergency caused by decades of spatial structural racism and then get rid of democracy, right? Then starve people further with resources, then impose an emergency manager. And that emergency manager and the bankruptcy enabled the region to steal the asset that created them. They got the goose that's laying the golden eggs by creating the Great Lakes Water Authority and really stealing control of that asset and all of its value from the Detroit water and sewer system. So if I'm thinking now about the rates and infrastructure, we see that the spatial structural racism really lies at the heart of water quality and water affordability issues in Flint and in Detroit. Strategic racism, which is a newer concept, which is talking about exploiting for political, private, or public purposes, the role of structural racism or express racism lies at the heart of emergency management, lies at the heart of the Flint water crisis, and the Detroit water shutoffs, right? These are all interconnected in a manifestation of this process of creating opportunistic behavior around spatialized, the racialization of space and the spatialization of race. And if this is true, then only intentionally using a racial equity frame can lead to a sustainable change for water justice, right? I'm not going to get to water justice. I'm not going to get to water affordability. I'm not going to stop the water shutoffs unless I'm very intentionally using a frame of racial equity. Until I'm seeing those things that are not there, until I'm seeing the relationship between the infrastructure and the spatial structural racism really is archaeological evidence of the injustices that I'm finding today. And quickly, if we sort of think, where do we go from here? Again, a racial equity analysis is essential for evaluating the nature of the water problems and assessing the viability of the water solutions. You know, we know the answers. This is, again, where it's very frustrating because it's not rocket science. We don't need to invent a new vaccine. We don't need to invent new therapeutic cures. The Honorable Reverend Joanne Watson helped fight for water affordability 20 years ago, and we need to pick that up and actually implement it. I would say we need to renegotiate the Great Lakes Water Authority deal. There's all sorts of things that are problematic of that, and we have to rethink the rate structure. And we can't have a rate structure that is defined by these geopolitical entities as opposed to thinking about a real regionalism footprint that would enable us to think about funding water affordability and all sorts of other things in a sustainable way if we had a regional footprint that included public health investments in the rate structure. And we have to start thinking about racial equity impact statements, right? We have to think about health in all policies as ways to incrementally change the political framework to deal with the structural racism that's built in, particularly in a post-COVID, post-George Floyd era. And we have to use racial equity as a frame for transformational social justice. And we have to see the relationship between the physical infrastructure that's necessary to support racial hierarchies and the need then to get this interconnectivity if we're going to start trying to find paths forward that are going to be more just. And I like to end where I always start with the judge and a shout out just to remember not just Judge Keith, but the important role that all of our ancestors are going to be playing and leading us forward in getting out of the morass that we find ourselves in. So questions, and I'll turn it over and mute myself.
Thank you so much, Dr. Peter Hammer, for giving us the racial framework of some of many of the things that have really propelled the disparities that we're seeing around water, not only here in Detroit, but it actually has spilled over into what we see playing out in Highland Park, playing out in Flint and other communities that are part of this water system. But the next thing that we would like to do is make sure that we're going to be able to entertain your questions. And so I'll now like to turn it over to Tiana Starks, who is the Director of Communications for We the People of Detroit. And as Tiana is plugging in, I want to make sure that I lift up our community research experts on water at the community level. They are part of our partners, not only with Westside Unity, Freshwater Futures, but also Redeem Detroit. So I would like to thank Mother Gwen Howard, who is the coordinator at the Redeem Detroit location. And I'd also like to thank Dr. Nefertari Kenze, who is leading at Westside Unity, for for being on the call along with all of their amazing teammates. So at this time, Tiana, would you take it away?
For sure. Thank you, Monica. And just want to echo your sentiments. Thanks to all of the We the People of Detroit partners. Thanks to all the panelists for your scholarship and for taking the time to be with us today and sharing your knowledge. And thanks to everybody who joined to learn, as we all did today, and for helping us to continue to move the needle forward toward water equity and justice. So as Monica stated, if you guys have any questions, please go ahead and type them in the chat box. And I'd like to open it up for our panelists. If you guys had any questions for one another before we start taking questions from the audience.
No, I think I'm happy to hear what the audience has to say. I'm fine.
Okay. Any questions? Okay, I'm not saying any questions just yet, but I do want to raise a point of clarity. Thank you to the Honorable Joanne Watson for your insight that in 2005, she, along with Marianne Mahaffey and We the People of Detroit co-founder Cecily McClellan, staffed and implemented the Water Affordability Plan with volunteers, Mother Chris Griffith, another We the People of Detroit founder, for 2 years using $2.5 million that was discovered that had been set aside by DWSD, off of budget proceeds of late fees and delinquent fees, not rate holder funds. That was just a point of clarity from one of the presentations. Josiah, do you want to speak more about that?
Yeah, I think that Reverend Watson could speak much more knowledgeably than I could about the deliberations that were occurring in the City Council and the work that she did with Marianne Mahaffey. I'm sure she has a deeply knowledgeable inside perspective on those proceedings. All that I can say is I've interviewed Roger Colton and some of the members of Michigan Welfare Rights. I've talked to Marion Kramer and Sylvia Orduno and others who were involved in that struggle at that time. And, they talked about, I read the original Water Affordability Plan, which in 2005 did propose a progressive rate structure. But the actual politics of the budgetary negotiations, I think Reverend Watson could speak expertly on that in a way that I could not.
Awesome. Reverend Watson, did you want to make any comments? I wonder if she's still on. I think maybe she has, she's coming back right now. Reverend Watson? In the meantime, any other questions? Reverend Watson?
Yes.
Yes, we were just speaking to your point about the Water Affordability Plan. Would you like to make any additional comments on that?
No, I think I explained it in the chat, but thank you for the opportunity.
Awesome. Jan Manafee, do you want to come off of mute and state your question?
Yeah, I can do that. 1 second. Hey, everyone. Thanks so much for your presentations. So something that I was trying to think through with all of them actually was this difference between, understanding the situation around water shutoffs and data collection, as well as the policy implications for homeowners versus people that rent. I still don't have a good sense of what the difference is between those two, housing options are when it comes to water.
Josiah or not, do you want to maybe take that one?
Well, as a historian, I'm always tempted to go back to the past. I mean, I could talk about how the policies of the past may differ from those of the present. I mean, one of the things that was going on, for example, during the Great Depression, was that landlords relied on payments from the Detroit Department of Welfare to cover rent for tenants who were unemployed. And oftentimes it was the landlords who refused to pay the water bills. And we know that that has happened today as well. But you know, the rates of home ownership in Detroit, overall, actually, the home ownership rates haven't changed as much as one might think. There's been a racial disparity in home ownership connected to housing discrimination. But on the specific issue of landlords and apartments and tenants and water shutoffs, what happened in the Great Depression was often landlords wouldn't pay water bills until tenants had paid full rent. And so preventing shutoffs often meant the Department of Water Supply was negotiating with the Department of Public Welfare to basically force landlords to pay their water bills rather than waiting until the rent had been paid in full. So often it was the water department and the welfare department negotiating with landlords rather than the tenants directly. But you also had a lot of homeowners who were falling behind on their bills. But in terms of the more recent situation, I mean, obviously, you know, the water affordability plan is intended to encompass both tenants as well as homeowners. And if that's one of the benefits, in addition to a moratorium across the board on shutoffs, restructuring the water rates would be beneficial for both tenants and for homeowners. But I'm going to leave it to others who are more knowledgeable about some of the specific struggles in more recent years.
I might just make one comment about the question that preceded that, this notion of public health data and what role public health data plays. And I draw an analogy to Flint. I mean, the only thing you need to know is that water is essential for life, right? And that's not in any particular domain of having a medical degree or understanding epidemiology. In the same way that in Flint, the minute that the water was coming from the river and people were getting the smell and seeing the color and getting the rashes, people knew that there was an adverse effect. And yet what we do is create structures that deny the knowledge that average citizens have, or that everybody knows intuitively about the importance of water, and require sort of this elaborate game in Flint to go about trying to prove that there was lead and that lead levels were illegal. And once I showed that lead levels were illegal, I would have a mandate for action, when everybody knew what the problem was already and what should be done about it. In the same way here, the activism around water has been so heroic in Detroit, and it's always been in a public health frame, right? Even as early as January of this year, when we were trying to get the governor to declare a public health emergency, she refused, right? It was really only until COVID came that the knowledge that everybody knew was brought to the fore, largely because it no longer affected just the residents of Detroit. Right, it affected potentially everybody in a contagious disease, and then they acted out of the appropriate fear for themselves to drive a policy result that already existed. Right, so we do have to play the games. We do have to create the data because that's the only thing that some expert institutions respond to. But we shouldn't ever forget the fact that the knowledge and expertise also exists at an intuitive level in what people experience. And to recognize the importance of that experience and the validity of that knowledge and expertise as well.
And I'll just add one thing. And please, I know Alice Jennings is on, or others can correct me on the timeline, but I do know that at some point the bills were sent in the address and not the customer name. And so often you would find that people, if they bought a house, for example, in the land bank, would be surprised that they would get this massive water bill that was debt that was attached to the property that didn't move with the customer and was kind of stuck to the house. And so you had a lot of houses that, even though they're on this land bank auction, couldn't be sold, had this incredible water debt that followed. And on the flip side of that, as you mentioned as a possibility, you can have landlords who are not paying the water bill. And so we saw whole buildings that lost access to water, including one building in downtown that was like a nursing home style building. So you can imagine that was happening before COVID. I mean, these are places with, by definition, medically vulnerable groups of people. As Professor Hammer said, obviously everybody needs water. It's vital to life, but you you begin to complicate that very quickly when the access is compromised. And so a lot of that, there was a big push for the department to reconcile their bills in like the customer's name, so that people even could pay their water bills who were able to or wanted to. And so there was just a lot of billing issues too. I know I just have a couple more minutes. I wanted to also shout out and thank our Water Peeps director, Eugenia Ballard, for organizing this, Pastor Ballard, and also just invite anyone who's on the call to just share your experiences or any thoughts that you have. It doesn't have to be in the form of a question to us.
Hi, I'm Gwen Howard, and I'm the coordinator for Redeem Detroit's Water Peeps program. As a retired social worker from the Department of Human Services, the water was always an issue. I noticed in some of the presentations the amount that they said, average 324. Engler did create a real problem with our customers when they stopped the vendor program. The maximum amount of water that we could pay for was $175 in a 12-month period. As an SER specialist for like 4 years, water was a big issue. And as we had a training where they came in and told us it was on the city charter that you could not turn off the water, but they were turning it off on every turn and around every turn. But the max we could pay for a water bill was $175. The maximum bill that was coming through there was $800, $900, $175 in a 12-month period. So you know that we had a lot of issues. And before they stopped the vendor program, which was, as you said, keeping these apartment buildings afloat because they knew that they would get that $210 a month for vendor rent. And then because they didn't have to chase their tenants down for their rent, they paid the bills. But when the vendor program stopped, they couldn't afford to pay the bills either. So it was a problem, and water was definitely a big issue, and it was always an issue. You would have to take it higher and higher and higher because the max they would pay was $175. And the landlords, the tenants, our renters didn't have to pay the water bill. It wasn't in their rent. It wasn't in their lease. And then the water is getting cut off and they lived there. So it was a real problem. I retired in December of 2010. So it's a lot of things that have changed and still went on, but nothing for the better, for the worse. So yeah, I experienced that for a while, and what could we do? And then when they come in with a water shut off, and it was shut off, then as a worker, you had to say that what's up with the children. So it was like a chain effect. You had to report this, that she has 6 kids with no water in the house. And now you're scared to even come in because now you think they're going to take your children and take them from you because you have no water. So it was a real problem, and it was nothing. And Engler had shut a lot of things down, and they did not care. And it was just a problem, a really big problem. So that's what I said. And I learned a lot on the other side of the water crisis from you guys' presentations, the data part of it, but I definitely knew the human part of it for almost 30 years. Thank you.
Thanks for sharing that. It's really, important, as Dr. Hamer was saying, that the community has always kind of known because it's a lived experience, right? With that,
one of the things I have not heard it mentioned, this is Sister Watson, I've not heard it mentioned yet, that Detroiters pay retail rates while the suburban customers pay wholesale. That's a huge demarcation, and it really amounts to apartheid budgeting for water. Detroiters who paid for the water system, who own it legally, pay far more than the suburban customers, the so-called regional customers of this illegal authority that was done under illegal hijacking of the city. But the city residents who own it have always paid far too much for water. They paid retail while the suburban customers have only been charged wholesale rates, which is a huge, huge assault on the budgets of the owners of the water system. And that's something that should be built into our presentation so that people understand it's institutionalized racism. It is, so this business about people not being able to afford their bills. The bills are not affordable because they're charging too much and always have. Thank you.
Thank you for bringing up that very important point that, you know, that we need to acknowledge as we're having these discussions. I think that also goes to kind of the presentation that Dr. Hamer was giving around structural racism and all these different things that play into how we ended up where we are today. Is there anyone else that would like to share before we close out?
Well, my name is Lou Banks, and I just wanted to say I have been being contacted by a group called Detroit Actions Neighborhood Summit regarding the water shutoffs in Detroit. And they were desperately seeking some type of help with someone being able to speak up for them, to stand up for them, the people that's unemployed, that's being affected by COVID, which all of us are. So I gave Errol Service a call. He sits on the board in Detroit. I'm not sure what board, but he was able to slow down the disconnects. So now that that order has been lifted, they say they're starting back to disconnect the water again in Detroit. So what's going to be done about that to stop these disconnects? Especially since the water belongs to Detroiters. I don't see why they're the main people that's suffering with the water shutoffs.
I can try to answer, if I could try to answer that question. The city of Detroit on the 9th issued a policy order on keeping the water running and no shutoffs. And it's supposed to be in existence throughout the time of COVID. So that's one thing that's going on. And it's basically what the city of Detroit, the medical director did, is she took the language that was in the governor's executive order and put it in a city of Detroit order. So if it's the city of Detroit. Secondarily, we do have a lawsuit many attorneys that were involved in the Lido litigation back in 2014. We're presently in front of Judge Denise Page Hood on the issue of the Fair Housing Act and how that's related to the disproportionate impact of water shutoffs leading to the higher rates of COVID. And in fact, Nadia Gaber is one of the experts in the case, along with several other experts. But we're fighting it. We're looking for, right now as we speak, having had a text from the Senator Chang and the governor's office and the two leaders of both the House and the Senate are supposed to be meeting within the next few days. For once, across the aisle, they're starting to look at some of the stop the shutoff legislation that we've been fighting for and wrote probably 5 years ago. And so this is the time to move us forward here for some permanency in the water shutoff. And I just think that we've got to really put our shoulder to the rock and push and push and push right now. So
yes, they're suffering. And with the COVID epidemic surging again, it's going to be rough this winter. You know, I'm getting calls and texts every day from people because my TV show, which is What's Up in the D, we get out in the neighborhood and we talk to the people and try to find out what's going on. I give my number, and when there's an issue, groups like this give us a call and see if we can't get in touch with the proper people to try to lend a voice to the problem that's happening to our people in Detroit.
Thank you so much.
Thank
And thank you, Ms. Jennings, for your response to that question.
Yes,
It was
thank you, Ms. Jennings.
You're welcome.
So thanks again to everyone who joined us, all of the panelists, everyone who came to hear the presentation. Thanks to We the People of Detroit and all of our Water Peeps partners for helping to coordinate and organize this event. We do have another talk coming up on the 29th, so be on the lookout for communication about that. This video will be posted for your reference on the We the People of Detroit site, so we'll send out a communication about that as well. And also, please feel free, you can email communications@wethepeopleofdetroit.com if you have any questions about anything you've heard, or you have any water issues or anything that we could help provide the right resources for. Please feel free to email me. With that, thanks everyone, and we will see you next time.
Bye.